For those of you who just joined us on Facebook, LinkedIn, YouTube, or Twitter, I want to warmly welcome you. But actually, the welcome is not mine to share tonight because the team leaders from the COVID-19 Peer Hub group of more than 6,000 immunization professionals from more than 86 countries came together last July, building on the work of the Scholar platform. Why? In order to respond and to step up to the COVID-19 pandemic in the face of its dramatic consequences to the on immunization services all over the world. 80 million children were estimated by Gavi to be at risk at that point, not because of the coronavirus, but because of its consequences from restrictions on freedom of movement, from the fears and the misinformation. For all those reasons, professionals from all over the world came together to go above and beyond with the Peer Hub. And in just, let me see how many minutes, in 2 minutes and 30 seconds, the Ghana team leader, Dr. Daniel Asomaning, and the Cameroon team leader, Dr. Martha Ngoe, will be welcoming you. They have come together and brought the active participants from both Ghana and Cameroon together to share in the middle of a global health emergency, to share what they are learning from vaccine introduction. And as you know, Ghana was the first country that we saw in the news as having received the first delivery of COVAX vaccines. Yes, built on the solidarity between countries, between all countries. And so we're going to hear tonight, it may be very late night or early morning for you, whatever the case may be, we're going to hear from them. Tonight is when the Ghana country team of the COVID-19 Peer Hub usually meets. And why do they meet on Sunday night? Because they are doing this above and beyond their day jobs. So they do this during the weekend. They have invited scholars from Cameroon, and we'll be hearing from them very quickly. See you in 1 minute and 15 seconds. Warm welcome to you. I am Martha Ngoe from the Geneva Learning Foundation. It is 8 p.m. in Geneva, but I am not your host tonight, and I am not the one from whom you will hear the words of welcome that matter, because this meeting, this inter-country rapid learning exchange, is actually being hosted by the scholars from Ghana, who are hosting and particularly welcoming their colleagues from Cameroon. Why? Because they decided to share and learn what exactly is happening with COVID-19 vaccine introduction. Our facilitator for this evening is also someone you know. It is Charlotte Mbu from the Geneva Learning Foundation. So I will stop here. If you do not know about the Geneva Learning Foundation, wherever you are seeing this, please go and have a look. But that is not the point tonight. The point tonight is really to open up a space for dialogue between countries. Before we go any further, though, I do want to greet some other people who are joining us online, because even though this is a meeting between Ghana and Cameroon, in our Zoom studio, there are only participants from those two countries. Immunization professionals from all countries are also welcome. So here we have Amel El Tahir connecting from the Kingdom of Saudi Arabia, Emmanuel Odunze from Nigeria, Suresh Dalpath, who says good luck for all, Neila Abu Dugan, who says hello. This is Tanvir Osen from EPI in Bangladesh, Meseret Degefa, who's happy to attend, Dr. Mariam Gamal connecting from Egypt, Dr. Mohammed Taimur from Pakistan, and Adam Hashi says, greetings, Dr. Daniel, great to see you leading the Ghana team. And Emmanuel Musa, who says, I will surely indicate my interest. Robert Ninson, a Gambian working in South Sudan. Hello, everyone, and good evening to all presenters and viewers. Happy to be part of this, to learn from these great teams, and congratulations to Ghana. Dr. Syed Amar Hussein Shah from Pakistan, Deepak Patro, Dr. Iwat Endayo from Abuja, Nigeria, Atahir Abubakar, also from Nigeria, Emeka Victory, who says, I'm glad to be here and eagerly waiting. And then Mohammed Imran Qureshi from Pakistan. And then I believe it is Mohammed Kaba from Senegal. So even though this is a meeting between two countries, and really we'll focus on those two countries, we have opened up a window so that immunization professionals from all other countries may also join in. So first of all, to greet the Ghana and Cameroon teams, we'd like to offer a round of applause before we go to Charlotte.
Hello, everyone, and thank you very much, Reda. So before I turn towards the team leaders for Ghana and Cameroon and the facilitators for the session, that's the MC, I just want to take the opportunity to greet all of those who are already also here with us in the Zoom studio. I'm greeting Eric Mboke, that's joining from Cameroon, Dominique Yeboah from Ghana, Adam Anas from Ghana, David Bakuri from Bole District in Savannah region. We have Bruno, that's greeting from Ghana, and Rachel Abom from Cameroon, CM Krista from Cameroon, Dr. Tebo Charles from Betwa in Cameroon, and so many others, Solange Wegan, James Bobin from Ghana. So warm welcome to you all, and it's a really pleasure for me to be able to support these two wonderful country teams this evening. So I'll turn directly towards Obed Nobe. Obed, if you can unmute yourself, you have the floor to present to us the team lead of Ghana and then the rest.
Yes, good evening, Charlotte, and good evening, everyone. We are pleased to have all of you for this very important special event for the Ghana and Cameroon countries that are learning experiences, trying to share experiences of COVID-19 vaccination. I have the pleasure to introduce to you our country leader, who has been very effective in mobilizing the country scholars that have taken WHO scholar courses ever since the scholar team started the program. We have with us here Daniel Asomaning, the EPI coordinator or manager for Eastern region, and who happens to be the country leader. Daniel, good evening. Hello, Daniel.
Hello, good evening, Obed. Can you hear me?
Great. Daniel, you are welcome to this very important meeting. of experience sharing on COVID-19 vaccine introduction. We want to hear from you as a country leader for Ghana on this special day.
Thank you very much, Obed. Good evening to every one of us here. Good evening, Rita. Good evening, Charlotte. Good evening, Dr. Etiano, the National EPI Program Manager, and all other members who are present here that I may not have the time to acknowledge you all. We want to welcome you all to our country meeting, and this is Ghana Country Group. And we, just as Obed said, we've been working very hard, and we're trying to be the level of support that will lend a helping hand to the National EPI program. So over the past years, we've been working hand in hand with them in trying to bridge the knowledge gap in terms of immunization, bringing on innovations to ensure that Ghana reach our goal of immunizing every person who needs to be protected with vaccines. So we are most excited to have you here. And Sundays has been very busy days for scholars in Ghana since we hold our meetings on this very day. And through our learning with the Geneva Learning Foundation, we have fostered peer learning among ourselves, so that whenever we learn from our colleagues, we share knowledge, then we help improve on the service we've been delivering on daily, monthly, and within that period of our places of work. So we were so excited when we had the opportunity to share our knowledge with our brothers and sisters from Cameroon, and our arms are wide open, and also those from beyond Cameroon. We are most grateful to have you here today. Our team are very poised to share with you the lessons we've learned, the knowledge that we've had, the up and downs, and all other aspects in the vaccine introduction. And we hope that by the time we finish with this meeting, we will all go certainly very poised, learned very hard, so that we can help fight this COVID-19, which is the global enemy. So on this note, I wouldn't want to talk much, since there are a lot of able people who will be taking up various aspects of the vaccine and its introduction, such that we're all going to enjoy our stay on this platform. So I would just urge us all to stay attentively and listen throughout the program. And I know by the time we're done, we'll be very pleased. So on this note, you are all welcome to this very important event, and just hope for the best. Thank you. Over to you.
Thank you very much, Daniel Asomaning, the country leader for Ghana. Now over to you, Charlotte.
Thank you, Obed, and thank you, Daniel, for that word of welcome. So I know you invited the country team leader for Cameroon, so it's also important that we get to listen to Martha Ngoe before we hand over once again to you, Obed, to facilitate the rest of the session. So Martha, if you are hearing me, please kindly unmute yourself. You have the floor.
Thank you, Charlotte. Good evening, good morning, good afternoon to everyone who is joining us. We are so honored to have this invitation from Ghana, especially at this stage where we are introducing the vaccine in Cameroon. It's always a good experience when we share our ideas together. It helps us to move faster instead of laboring in one little corner on your own. So I believe so much that we are going to be learning so much from Ghana's experience on the vaccine introduction in Ghana, as we have just started in Cameroon. I just want to warmly thank everybody who have joined us today, and I hope a whole delegation from Cameroon who have come to learn the experience from Ghana, that is from the national level right at the facility level. We hope we are going to have a very fruitful interaction this evening. Thank you all.
Thank you very much. Thank you very much, Martha. And I can see hurrah from Solange Wegang in the chat, and also thanks from other members of your team. So I'm going to turn now towards Obed to present to us what the agenda, the menu that they have prepared for us tonight?
All right.
Obed.
Thank you very much, Charlotte. Tonight, we have the pleasure to have our national EPI manager with us. So he'll be presenting to us on how Ghana introduced its COVID-19 vaccine and experiences that were learned. He will be sharing that with us. Then also, after that, we'll be taking some questions and answers from participants. Immediately after that, we'll be taking experience sharing from scholars from the Ghana country team, right from the regional level to the district or municipal levels or metropolitan levels. They'll be doing presentations. Then from there, we'll take questions and then we'll move on. So this is how the outline of our presentation will be tonight. So at this moment,
Obed, if you permit, I just want to add that if you're watching us on our social media platform, that's Facebook, YouTube, LinkedIn, or Twitter, feel free to type in your questions once you're listening to the speakers. Feel free to type in your questions. Rhoda is there to show us and read out the questions for us so that the panelists in the room can give you the answers that you need. Thank you, Obed. Over.
All right. Thank you very much. So without wasting much time, we want to call on the EPI manager for Ghana to present to us the COVID-19 vaccine introduction that was done in the country. I have the pleasure to introduce to you our own PM in the room with us. In fact, he has been very supportive right from the time we started engaging the PM, and he's in the person of Dr. Kwame Amponsa Achiano. He's the National EPI Program Manager. At this moment, I want to invite our PM to present to us on COVID-19 vaccine introduction. So, Doc, your audience tonight.
Thank you very much. Hello to everyone. I hope I am audible enough.
Yes, you're loud and clear.
Yeah.
Excellent. So I'm happy to be here to, in a way, have a tete-a-tete on how Ghana has come in terms of COVID-19 vaccination program. I would follow an outline like this, a brief introduction and background, a few comments on our national deployment and vaccination plan, the governance structures, because that is so crucial for any introduction of vaccine, how we defined our population segmentation. We prefer to call it segmentation rather than prioritization, because that gives us a lot of room to, in other words, communicate well. And our current status of the rollout, some successes, a few challenges, and our lessons learned, and then draw a couple of conclusions. So by way of background, as most of you would know, Ghana is part of the hub of West Africa. We are some 3 countries away from Cameroon. So the intervening countries are Togo, Benin, and Nigeria, and then you are in Cameroon from west to east. We have a total population of approximately 31 million. Our population lives in 16 regions for administrative reasons or management. There are 260 districts in terms of governance structures. Yes, you would recall that WHO declared the pandemic of COVID-19 on the 11th of March, 2020. Unfortunately for Ghana, a day after that, we also had our first 2 cases simultaneously. And as global efforts towards a search of vaccines went on, Ghana also prepared to receive vaccines and, of course, deploy them. COVID-19 vaccines, as we know, are additional preventive measures to the already existing protocols of face masking, physical distancing, which quite a number of people term social distancing. And they will have hand sanitizing, and of course hand hygiene, washing hands under running water with soap. We have had only two vaccines so far that have undergone emergency use authorization by the Food and Drugs Authority, but we do know that there are several other vaccines that many other countries are using. We basically have had AstraZeneca and Sputnik V vaccines passing the emergency use listing in the country. This slide is showing us our COVID-19 situation as of this afternoon, around 4 p.m. Today. We've tested a little over 1.1 million people. We have had 92,601 cases confirmed. Most of them have been discharged. Unfortunately, we've lost 779 people. So we've had a little over 90,000 discharged so far. Our active cases stand at 1,574. As you can see on the slide, there are some regions that are hotspots. They have had the brunt of cases, particularly the southern sector, especially in the Accra region, so Greater Accra region. Also have had quite a number of cases from the middle belt, that's Kumasi, that's the second largest city in the country. And then some other regions are also coming up quite well in terms of active cases. We have the central region, which is more or less a southern region. Also have the western and then the eastern, and quite a number of other regions also recording or having active cases. The cases are skewed towards males. There are more of males. It's about 57% against females of 42.5%. So this slide is showing us the epic curve since we started recording our cases. We've had, largely speaking, 4 waves. First minor wave and a huge wave, which coincided with what in the global world they're talking of as a first wave. Then we had another small wave, and then a second huge wave, which corresponds or coincided with the so-called second wave. Since the past couple of weeks, maybe up to about 6 weeks, we've declined in our number of cases quite dramatically. And so we hope to remain and not enter into the huge third wave that is happening across many countries, particularly in Brazil and India. So to talk about vaccines and deployment, we need to look at our plan. The National Deployment and Vaccine Plan for Ghana was developed using guidelines from the Strategic Advisory Group of Experts, SAGE, and then of course the National Immunization Technical Advisory Group within the country. So they have the documents they issued out guided us in preparing our plans. So our plan is quite comprehensive. It includes regulatory preparedness and safety monitoring. Of course, if you are introducing a new vaccine, you need the regulatory aspects. We work closely together with the Food and Drugs Authority, with the National Regulatory Authority in the country. We also have a section on planning and coordination. Our vaccination strategies is also quite well explained in the plan. Our deployment systems and modalities, immunization monitoring systems, looking at basically at the data management of the vaccination exercise. We have a section on operational research and surveillance. So we are working with quite a number of partners on this. Communication and information. In fact, overcoming hesitancy is one of the key things when you're talking about COVID vaccines. The supply chain processes, including how the vaccines flow in, waste management, the cold chain issues, and so on. And then, of course, monitoring and evaluation. So by way of governance structures, we have the Interministerial Coordinating Committee. In fact, this is the highest decision-making body, chaired by His Excellency, the President of the Republic himself. They hold meetings every week. We are fortunate to be part of those meetings, so we get first-hand information as to the policy direction. And there, as I indicated, they are in fact, the highest decision-making body in terms of the overall mechanism of COVID response, not just on vaccination. We also have the National Technical Coordinating Committee, which rests within the Ministry of Health and serves as a technical expert committee in the monitoring of the implementation of all activities, including vaccination. Then we have the National Public Health Emergency Operations Center, which is housed by the Ghana Health Service, which is an offshoot of the Ministry of Health, and is responsible for coordinating the day-to-day COVID-19 response activities. Then particularly for vaccine readiness and deployment, we have a technical working group for COVID-19 vaccine, and is responsible for planning and deploying the COVID-19 vaccines. And I happen to be a co-chair with my Director of Public Health. The Interagency Coordinating Committee for Immunization is a standing committee that has an oversight role of the EPI program in general and coordinates technical and material inputs to the program. And at the regional and district levels, we have replica committees, basically the public health emergency management committees that are responsible for preparedness and response activities, and they coordinate these at those peripheral levels. So how did we define our population segmentation? I have mentioned that our segmentation, the planning was influenced by guidance from SAGE and NITAG, and that includes a segmentation or what many people will call as prioritization. So our distribution strategies have been based on segmentation of the population, informed by risk of exposure, disease severity, business continuity, and of course, national security, because COVID-19 is a national security issue. Apart from population segmentation, we also looked at geographic segmentation, where, if you remember the very first presentation, the very first slide or so, we talked about regions that are hardest hit. So our strategy has been to vaccinate those hotspots first in a phased approach, but ultimately to reach the entire population. So the hotspots are what you see deeply, those that are in deep red or very dark red. So we had to segment the population and had some groups. So group one looks at persons at highest risk, healthcare workers, frontline security persons, those with known underlying medical conditions, the elderly defined as 60 years plus, frontline members of the executive or the arms of government, so the executive, the legislature, and judiciary. Remember, for business continuity, the government must run, the country must run. So if these people come down with COVID, the whole nation would be at a standstill. Of course, teachers above 50 years and other essential service providers. And we have a group two that looks at more at all other essential providers, including water, electricity, the telecommunications, students, teachers, those who will not be covered in the group one, those involved in fuel, food value chain, the waste management people, media, commercial transport, including air traffic, intelligence agencies, and of course the rest of the arms of government. Then we have a group three, which is the rest of the general population who are 18 years and above because of the current vaccines we are using. And then, of course, last but not the least, all other people, particularly pregnant women and children under 18 years. At the time of the deployment, we do not have enough safety data on those vaccines for these people. But once vaccines become available for them, they are not left out. Our assumptions have always been that vaccine supply will span a long period, and therefore vaccine deployment had to be staggered. And that is exactly what we find ourselves in. Unlike when you are doing a polio campaign where you get all your vaccines at the same time, you know that COVID vaccines have been very special. And so we need there to strategize. So to date, we have received approximately 966,850 doses of AstraZeneca vaccines, and the date of receipt and the sources are provided. So as Reda said initially, we, as Ghana, was the first country to receive any vaccines from within the COVAX facility. And we are quite excited because that shows the readiness in terms of our planning process. So below you see quite some pictures taken during our But there was a bit of fanfare on this because we were quite excited to receive those vaccines. And you see, at the airport, special guests and the Minister of Health and all the people at the helm of affairs were there to receive the vaccines. We've received a few doses, a few thousands of doses from the Indian government, 50,000. The government of Ghana had initially purchased some 2,000 for people on special assignment. Then the MTN Africa generously donated some 314,850 doses to us, and in 2 tranches. The first tranche was 165,000, and then second tranche 149,850. Then the government had also gone into negotiations with the Russian, some UAE intermediaries to get some of the Russian vaccines, as the Sputnik V. Unfortunately, they come in 2 different components, and these are different vaccines, so to speak. Sorry. The first component we had, that's the first shot, we have 10,000, and then the second shot we have 6,000. So you need a balance of the 2 to deploy. So as of now, we have 4,000 of the component 2 to receive. Otherwise, we cannot use all of them. We can only give to 6,000 people. So the rollout, the current status of the rollout. We have done 2 major phases. Phase 1A, using the 600,000 doses that we received, that's the AstraZeneca vaccines that we received through the COVAX facility. So we targeted 43 districts, hotspot districts, out of the 260 districts in the country. So we've completed those for health workers, frontline security persons, looking at our initial plan, as I've already mentioned. It was launched by His Excellency the President Nana Akufo-Addo on the 1st of March, and on the 2nd, we began our rollout. And then we had a phase B, which targeted the rest of the 217 districts that had been left out. And our target was mainly for healthcare workers, including students in their clinical years, who perform duties just like any healthcare worker. Then when we had the vaccines from MTN, so we did this in tandem with the phase 1B. So we completed that on the 13th of April. So we had those vaccines around Easter. So during Easter, we were vaccinating, and we completed on the 13th of April. How did we overcome hesitancy? Many countries would tell you, hesitancy has been a big problem. Communication strategy had to be developed, out of which we had key messages, stakeholder mapping, and engagement. In fact, we engaged many stakeholders, especially the health professional groupings, the medical group, the doctors group, the pharmacists group, the nurses group. We engaged the psychologists group. For almost all the health groups were engaged, as well as traditional leaders. We engaged religious communities, because some of the misconceptions were coming from some of the religious leaders, not in Ghana as it were, but from other areas. And so we had to actually engage them. And religion is one of the key means of spreading information. We did a lot of infographics that showed people where to go for vaccines, especially for those that we have started for the 43 districts. We did a lot of jingles, and posters, and flyers, and together with the regulatory authority, we came up with frequently asked questions, and that guided us in overcoming hesitancy. Some of us were on TV, radios, and not just at the national level, our colleagues in the regions and districts also did their bit. We used quite a number of media outlets, mass media, local FM stations, community information centers. We resorted to Twitter, the Facebook, WhatsApp. We were counteracting some of the misinformation that was going around. We used the National Commission for Civic Education, which is more or less the body responsible for mass communication of the community. We use the Information Services Department to support the health service in propagating our messages. Mr. Jacob and Dr. JHS. We did a lot of preparations in preventing and responding to misinformation, as I've mentioned. So we did a lot of stakeholder engagement. We were proactive in dealing with the media. We had hosted social media handles. Spokespersons had been trained, and we also had come up with holding statements just in case some issues that had arisen or had arose so that we could respond immediately. Then we sent out safety surveillance updates in conjunction with our regulatory authority, who we have been working with over the past years. We developed dashboards to get people information as much as possible. So on this slide, you see samples of our flyers on top, and then the infographics that showed people where to get their vaccination, especially in those 43 districts that started the vaccination. Yes, again, I mentioned that His Excellency the President did a launch. So on the top left side, you see the President and his doctor interacting during the launch. That is when he openly received his vaccination in public. In the middle, top middle, you see the First Lady, Her Excellency the First Lady, also receiving the jab. At this time, she was being counseled. On the lower left, you see the Second Lady. And then lower middle, you see the Vice President almost simultaneously also receiving his jab in another facility. And then on the top right, you see the former president and the opposition leader also contributing to overcoming hesitancy. In the middle, right middle, you see one of the kingpins of the traditional authorities in Ghana, so Tunfor Asantehene, who also received his...
Hi, Dr. Kwame.
Hello.
Yes, forgive me for interrupting you, but we are getting a flood of questions that are coming in from Facebook and also here on the chat and the Q&A. And we are already 30 minutes over the 60-minute mark for the session. So please, can we just try to wrap up so that we can really get to the Q&A? I'm really looking forward to having you answer some of the questions, and also other panelists in the room from Ghana get hitting on the questions already. So thank you.
That is fine. So let me then veer straight to the data management. We went fully electronic. So we have tracked everybody who has been vaccinated. We also issued out vaccination cards, which has a hologram, and then also some, as it were, media infographics. Yes, so this is how far we have come. We vaccinated nearly 900,000 people. This is what has been uploaded onto the database. These are daily vaccinations since 1st March. And as and when we get vaccines, you see that when we had the initial vaccines, we went up. And then once the vaccines got finished, we plateaued. So this is a vaccination by region. Essentially, we've done approximately 4.9% of the total population. We are only limited by vaccines. And Greater Accra and Kumasi, those that are hardest hit, have had the highest coverage. This is vaccination by sex and, of course, by faces. So the left is on the face, the right is by sex. So we have almost equal male and female distribution. For selected variables, we've done almost 90% of all health workers in the country. We've done approximately 50% of security agencies. And then for the aged, we've done just about 8%. And persons with underlying conditions, we've done almost 8% as well. So this is performed by the segmentation. Almost all the initially segmented people have had their fair share. So we have stuck to our segmentation: healthcare workers, security agencies, executive, the aged, those with underlying conditions, the media, and so on. We've also monitored safety. We haven't had any big issues with safety in terms of AstraZeneca. We've had quite a number of reports, basically headache, fever, weakness, generalized bodily pains, like the package insert has indicated. And so largely we've had a few serious adverse events which are undergoing causality assessment. So in terms of successes and challenges, we've had high-level political support from the presidency to the local authorities. Support from partners has been tremendous. We've had health and immunization systems providing platforms for the rollout. So we are using our existing systems. All COVID-19 protocols have also been observed at all centers of the vaccinations visited. But these are not without challenges. We've had some level of misinformation and disinformation, especially on social media, which we've tried to go around. Our initial data management had been challenged, especially when we had inadequate tablets for data entry and recording. But as of now, we've overcome that. We are currently also exploring the possibility of using a vaccine app to book appointments. So in conclusion, I'll say that the start of the COVID-19 vaccine rollout in Ghana has been hugely successful. And with support from partners, the country hopes to achieve its vision of vaccinating all eligible persons. In fact, we are starting with 20 million people, and we hope that with that we'll reach herd immunity within the shortest possible time. So our next steps are that we'll finalize our data management issues before the second phase, or the second people get their second doses. We are pursuing additional vaccines. We are continuing demand generation activities. We are also doing our vaccine accountability processes. We're documenting our best practices and challenges, and of course the lessons learned so far. And our mantra has always been that until everyone is safe, no one is safe, just as the whole world is looking at in that same sense. So with these few slides, I thank you for your attention.
Thank you very much, Doctor, for that wonderful presentation. Reda, could we get an applause for Dr. Kwame? Thank you so much, Reda. Before we move forward, we dive into the multitudes of questions that we have here. I just wanted to invite you, Reda, to just recognize those who are actually watching on the social media platform before I start going through the various questions that came in through the Q&A and also on the chat and from Facebook while Dr. Kwame was presenting.
Thanks, Charlotte. So there are some very specific, very professional questions coming in from all over the world. Too many for me to be able to summarize them quickly, but the concerns are similar to those we saw in the inter-country exchange between the Democratic Republic of Congo and the Ivory Coast. So yes, there are professionals from all over the world who are listening to Ghana and Cameroon and to the exchange you are having in order to better understand and learn from you. So please do keep that in mind as we go, even if the focus is on these two countries tonight. Thank you, Charlotte.
Thank you very much, Reda. So I'll just go through the questions with you. So the very first question that came in via Facebook was from Robert Ninson, Gambian working in South Sudan. He said, can the Ghana team briefly describe how they were able to engage the community with COVID-19 key messages? And I think some of the questions you already looked at them in your presentation, Doctor, but I just thought, okay, it's good to just see what people are actually having in their mind as questions. So briefly, in a few seconds, can you, and that question is actually linked with another question that was in the chat. We are going to look at it in a while, but the key messages, what was the target audience? How did they accept them? Dr. Kwame.
Thank you very much for those. I thought I answered quite a number of them in my presentation. The national committee, in fact, we engaged almost all the health groups, the health professional groups that are existing in Ghana independently. And they, in turn, communicated with their own groups using several platforms. So we use that strategy. Then there's also the National Commission for Civic Education. They do community engagement. We engage them, we train them, and we are still doing that. And they actually took up the mantle, work with the Ministry of Information, the Information Services Department to engage the community. But of course, the district health directorate also engage the communities themselves. And since we haven't gone widely as in the general population, but more of a segmented population, they have also been targeted in their message delivery. We've used mass media, we've used the publications in the print media, the radios, the community information centers, where you have PA systems mounted on very long poles. I'm sure it's cross-cutting in West Africa, where people broadcast and the communities hear information. So that's the way we went.
Thank you, Doctor. Another question from Mohammed Imran Qureshi from Pakistan. He said, what different SARS-CoV-2 strains were reported in the country, that's Ghana?
So we have basically had more overriding, now I would say that for strain specificities, more of the UK strain, of almost 99% of our strains being the UK type. And that has
okay. Been. And another question from Tawase Rodri from Cameroon. Say, have you recorded any cases of AFI? And if yes, how severe are they related to the vaccine? How were they managed at facility level? I guess those are so many questions. And there is Gaston Wamba that directly related the AFI to AstraZeneca. So what can you say about that?
Okay, so I made a presentation on AFI as well. We've recorded over 2,000 reports. We've had 2,000 reports. Well, we are using multiple reporting strategies, hard forms where people filling at the facility, the health facility level. Also, you've been using a mess safety app, which is in conjunction with UK, and it's championed by the regulatory authority. And then also reporting to a website. We've done so far 21 serious adverse events have been reported. 16 of them have undergone what we call the causality assessment, where the expert committee decides, or based on principles, decide which one is related. We have had, I think, 5 or so related to the vaccine, but these are all febrile illness. One of them was, I think, if I remember well, a sickle cell patient who, after the vaccine, got admitted. In fact, serious adverse event does not necessarily mean severe. What it means is that the person was either hospitalized, put in the hospital overnight, or it was a life-threatening event, or led to disability, or prolongation of hospitalization, and then also if it's congenital, and leads to congenital anomaly. But we are not giving those to pregnant women yet. So it's only 5 that I know have been product related, but these are all febrile illnesses.
Okay, thank you very much. There's a question from Rachela Baum. She's from Cameroon. That's on the Q&A. And she says, we know there are different types of vaccines produced by different countries, and you already showed the vaccine that you use in Ghana, Doctor. So that's answered, but it's the second part of our question. Say, how do you manage the online misinformation? And do you have any data showing a proven commitment of social influencers?
Yes, so we have a whole division of health promotion that tracks misinformation and then gives us the data, and then we also manage it. We also have partners, particularly PATH and UNICEF, that support us in responding to some of these misinformation. UNICEF has even supported us to do some quick appraisal, knowledge, attitude, and practices to know what proportion is likely to be hesitant. Before the rollout of the vaccine, we were hovering around 70% hesitancy. By the time we started, it had dropped to approximately 20-25%. And so we have a structure that monitors that as well.
Okay, thank you. There are so many more questions, but I just want to recognize the presence of Dr. Ngoe Andreas Ateke. That's the Deputy EPI Manager for Cameroon that joined us a while ago. You're welcome. And we also have Dr. Mboke Eric. I just want to invite Dr. Ngoe. Please, can you unmute yourself? And you listened to Dr. Kwame. Are there any questions? Having just recently introduced the COVID-19 vaccine in Cameroon, are there any questions that come to your mind after listening to the Ghanaian experience that's shared?
Yes, thank you so much, Bo, for giving us the floor. I think the presentation has really been so good. For us, I realize that Ghana has gone a long way. And most of the time listening to him, I was just gaining some information on how they were managing, or how they have been managing to succeed so far in Ghana. I think Ghana has done a lot. And I also realized that the they did a lot of collaboration, and they are greatly using the community actors, and there's a great coordination at the level with other agencies. I think that is really a great story we have learned from Ghana. And for now, I don't have a question, but I think I've learned a lot from what he has presented.
Okay, thank you very much, Dr. Ngoe. And I do hope if we have the time, you will tell us a little bit on how the COVID-19 vaccine rollout is going on in Cameroon. So there is a question on data in the Q&A that I really wanted to ask the Ghanaian team. And I may want to turn towards, go a little bit down to give a breather to Dr. Kwame. So I would like to turn to Dr. Hilarious Abiu with this question. So how do you collect, aggregate the data related to vaccination in terms of the number of people immunized and corresponding coverage? What are the advantages and challenges about the DHIS2 system, and are there any new modules? So, and that question is from an anonymous attendee. So please, if you ask a question in the Q&A, please, it will be really good if you can identify yourself. Thank you. Dr. Hilarious?
Right, Cheryl, thank you very much. I think that largely our program manager, Dr. Kwame Amponsanchiano, has addressed that question actually. The data collection for the vaccination exercise did not use the DHIS platform directly. We're using a vaccine app to first of all register all the eligible persons to be vaccinated, and also during the vaccination, the data on them were also collected using the same app. At some point, we had to use the ODK also. Okay, so the data aggregation and everything was done electronically, not manually. So as we key in the data for the people who were vaccinated, this data is aggregated, at the national level. And then there's a dashboard. So if we're using the vaccine app, those who are vaccinated using the vaccine app, even at the regional level, you can open your dashboard and be able to pull up the data on the numbers that have been vaccinated and the other characteristics of the vaccinees. So that's how it happened. I guess at some point, maybe we may collect the aggregate data from the vaccine app and probably do the data entries in the DHIS platform. But at the moment, we are not using the DHIS platform directly. I hope that answers the questions.
Yeah, thank you very much, Dr. Hilarious. And there is a question here from...
Hello, Charlotte.
Yes, Dr. Kwame, you have something to add, surely.
The National Data Manager is online. I think he will be the best person to respond to this, to add to what Hilarious has just said. But he is a main man. He's a key guy to answer this question.
Okay, so if he's here on the panel...
He's there.
So please, can you...
Charlotte is in the person of Emmanuel Sally.
Sally. Okay, Emmanuel Sally, please unmute yourself.
Okay, all right. Am I audible?
Yes,
you are.
Okay, all right. So thank you very much, Dr. Chanu and all other presenters. I think just to add to what Hilarious mentioned, basically, we started for the whole of the phase 1A, we started using the DHIS, not just the DHIS, but the tracker component of the DHIS. So one of the questions in there was talking about aggregate data that we got for the PM's presentation. No, in the DHIS, there's a tracker which gives transactional data. Okay, so that is how we used it. And then along the line, as PM mentioned, the whole plan is to get one system that
lost Sally.
Sorry, Emmanuel, we seem to have lost you there.
Lost Sally. Okay. No problem.
Okay, I hope we are able to get him back. So while expecting his return, I would like to turn towards Gaston Wamba from Cameroon. He asked a question. here on the chat saying just to know what's the hesitancy level among health personnel in Ghana. So I want to, and that's not the first question Gaston is asking. So I'd like to invite you, Gaston, to unmute yourself if you want to elaborate more. Having listened to the presentation of the country EPI manager from Ghana. Gaston, are you able to unmute?
Yeah, I've tried to unmute myself. Are you getting me?
Yes, we are.
Okay, the question is just because for now, when we take the C-trip of just 2 days ago for the whole Cameroon, we realize that we are at around 6,800, 6,000, a little bit more than 6,000 people who have got the vaccine. So, knowing that the health personnel were the people to be targeted first, we don't know. We don't want to know the experience that Ghana had. If they having here, because I know many of us have question to know. And then I wanted to follow up targeted population health personnel vaccinated or their strategy and how did they go to.
Okay, and Gaston, please, can you kindly introduce yourself? Tell us who you are, where you work, and what you do, so that the Ghanaian counterparts will really know you.
Yeah, I'm Dr. Gaston Wamba, WHO consultant for COVID in the West region of Cameroon. So that's what I'm doing right now.
Okay, thank you.
Mm-hmm.
So,
Okay.
Dr. Kwame?
Charlotte, if I got the question right, because he dropped along the line, that is it better to start with health workers, or it depends on their plan. We in Ghana had a clear plan of a segmented approach. And within the population segmentation, we also had geographic segmentation. So I don't know what Cameroon's plan is, but it's better to go alongside what the strategic advisory group of experts, and if they have a replica of the NITAG, they can guide them in their planning process. Again, they can use if they've done a KBP study, they can use that to guide them as well. We were guided by the SAGE approach, and of course, also guided by this NITAG, that's the National Immunization Technical Advisory Group.
And he really wanted to know the hesitancy rate among health workers.
Yes, it was quite surprising. We didn't think that health workers were going to be hesitant, but it appears that health workers' hesitancy is it mirrors that of the general population. And so along the line, we decided to fashion out clear messages to target our own health workers. And that is what we have done so far. But the hesitancy would be around, remember I said that it had dropped from 70 to approximately 25-30%. And it's just a mirror image, same across the rest of the population. Health workers are also quite hesitant. Over.
Okay, thank you very much. And I also saw a question here from Dr. Mboke Eric from Cameroon as well. So, and please, if you're invited to unmute, you kindly introduce yourself, tell us who you are, where you work, and you tell us why the question, the information is relevant to you, because he wanted to find out from the data manager. I said, please, the data manager, elaborate on the AFI reporting system. So I don't know if Sally Emmanuel, if you're still able to unmute, and we do hope we'll be able to get you clear this time around. So Dr. Mboke, please go ahead.
Thank you, Charlotte, for giving me the floor. Dr. Mboke Eric, I am in charge of surveillance and monitoring at the Central Technical Group EPI Cameroon. So the reporting of AFI is a really challenge in Cameroon. That's why I wanted to know. We have started vaccination in Cameroon since the 12th of April. And right now we have some regions that have not even reported one IFE. So, and we think that there are many IFE that are on the field and they are not reported. So I just wanted to know. I have heard about what Dr. Kwame said, and then as far they have reported, I think 20 many IFE, among which we have some about 20 severe AFI. So I wanted to know the system they are using. Are they going through the same electronic system, or they are using ODK for EFI? So that's what I wanted to understand. Thank you.
So Charlotte, let me respond to this because it's something that we've been working with the regulatory authority. Ghana has what we call the Food and Drugs Authority. By law, they are mandated to monitor adverse events. Strategically, we also have ceded that, as it were, function to them, so that we are not the referees and players and ombudsman at the same time. But of course, AEFI reporting cannot be done without a health system. We have structures at every district, almost every community or sub-district at West to report adverse events. So that at the national level, there is a coordinator based in my office, and then I support him, who links up with the Food and Drugs Authority, and together we plan everything from, and the Food and Drugs Authority also have focal points at the regional level and of course at the national level, and we plan together with them. So they are part of the training, even for the planning. The document we produce, they were part of it. So we work hand in hand, and they have structures only up to the regional level. So we support them at the beyond the region, and then we report using the Mess Safety app, which is an electronic app on the, should I say, it's an app on the ordinary phone. Also have an online system, which we report. Then we have the telephone reporting, which is the telephone numbers are put on the cards that we issue out to the vaccines. And then above all, we also have the structures, the original structures for the routine immunization, where paper-based reports are also accepted. So we use multiple strategies. And that is how come we've had quite a number of reports. And we are happy when we get a report. It means at least the surveillance system is working. So over.
Thank you very much, Dr. Kwame. And we have 3 raised hands right now. Francis Akum, I see you are already unmuted. Please kindly introduce yourself and then go ahead if you have a question.
Yes, I'm very happy to be part of this program. I'm Dr. Francis Akum, a PhD holder in public health, a freelance public health practitioner. I've been monitoring this COVID vaccine issue. I know the president of Ghana has been so committed, even the entire country of Ghana, all committed.
Sorry, Dr. Francis, are you from Ghana or from Cameroon?
Yes, I'm from Ghana, but I just want to make a contribution on the hesitancy rate in Ghana in terms of the vaccine.
Okay.
You know, we are also there to cross-check what is happening in the mainline activities of the EPI. And I've seen that during the vaccination of the COVID-19 vaccine, there were a lot of issues at the periphery. Most people who were engaged in the vaccination couldn't even explain so much to the general public. For example, they couldn't tell us, why should I jab the vaccine and say, wear a mask? When will I be free to walk around without a mask? After the vaccination, they couldn't tell anybody. So I want to tell Kwame and the team that still the sensitization is not going down well with the general populace in Ghana in terms of the COVID vaccination. So they have to step up on the campaign and then educate the general public, because for me, they couldn't tell me. And I went around from point to point in Upper East region. I'm from Boko. They couldn't tell me. So I suggest that for us to drop down the hesitancy rate of people accepting the vaccine, they have to still step up. Especially, they have to engage so much with the health staff at the periphery who are administering the vaccines, or else it's not going to really work very good for us. So that's a contribution anyway.
Thank you, Dr. Francis Akum. I see there is another hand that is raised, Theophilus Kofi Tikata. Theophilus, we are going to take that last hand before we move forward. Theophilus, please, can you unmute? There's also Rexford Ofosu, so the first person to unmute will. Okay, I see Theophilus probably raised his hand by accident. Okay, Rexford, over to you.
Okay, before the vaccination and before the even procurement, we try to let the information circulate for people to understand what we are doing. So people brought in so many messages. Some were misconceptions that the vaccine is coming to kill people, it's coming to wipe people away. So we have
Please,
information.
Rexford, can you introduce yourself? Tell us who you are, where you're from.
And just a reminder as well, if you are from Ghana, what your colleagues from Cameroon are interested in is what you have actually done and carried out and how it has turned out, not general considerations or opinions about various issues. Thank you.
My name is Rexford Ofosu. I'm working in the Upper West region of Ghana. I'm a public health officer, health promotion specifically. Before the procurement, the information was circulated that this is what the government is going to do. So people were aware. That's the part of their awareness creation. So people started communicating, those who are NDC and other parties, those who are not with the NPP, they were talking against, it tends to be a political issue. So they were talking that, the government is trying to wipe people away, or the whites are trying to wipe us away. That's why they are bringing the AstraZeneca to us. So that's misconception. So we try to capitalize on that. And then the social media platforms. We use the social media platforms. We use the TV stations we have.
Exactly what was the message that you communicated to them to get them to change their thoughts? So what did you say to them that made a difference?
Yes, we told them that after we had the information that they are saying that it's coming to wipe people away, we said, no, it's not like that. It's not coming to wipe you away. It's coming to increase or build up your immunity level. So people understood it, but many of them were not actually understanding the issue. They still doubt. So we used the stakeholders as the president, the vice president, and then the wives and all the dignitaries were injecting in front of them on camera. They began to change their perception that, oh yeah, it's true. As the president is injecting, it means he himself has injected. So it shows that it is true. So people began to go to the centers to inject. So that's all I can say. And on the AEFI, they tried to investigate whether what people were saying was true. So they actually probed into the issue by testing, trying to find out with the lab testing and all that, to actually ascertain whether it is true, as people were reporting that I have a headache, I have fever, I have this. So when they got, when they are deploying the vaccines to the centers, they give some paper that has information on it. Are you feeling dizzy? Are you having headache? Are you having a fever? Then they answer as well. So that information is what we used. And then when we probe into it by lab testing, we know that it is not from the vaccine, but rather other underlying conditions. It may be from other underlying conditions, which was not coming from the vaccine. So this is what helped us to know that it is not from the vaccine, but other underlying conditions. If you are having other diseases that might cause that, the vaccine might trigger it, but it is not the vaccine that is administered that is causing the problem. So that was why we were able to capitalize on what people were saying, and then we addressed the issues one after the other for them to understand that it is not the vaccine itself, but rather it's coming to build their immunity.
Thank you very much, Rexford. And I see the raised hand of Bimba Felix from Cameroon. I'm sure that's for now, because we are already above the 60-minute mark that was slated for the session. But I just want to crave your indulgence if you're watching us over Facebook or you're here in the Zoom room. Let's just go a little bit over time, because what we are discussing, I'm sure, is going to be very helpful for the Cameroonian EPI community that has just rolled out the COVID-19 vaccine. So Bimba Felix, if you can unmute yourself, please do remember, introduce yourself. If you have a question, ask the question directly so that our Ghanaian colleagues can provide the answer. Over to you, Felix.
Okay, my name is Bimba Felix from Ghana, a disease control student. What I did also to help my vaccination card to friends to boost them, or also help them get their morale to go for the vaccine. Yeah, thank you.
Okay, thank you very much, Felix. And there's a comment here from Ruth Alote that says, I believe that in the hospital facility where I work, and she's here on the panel with us, I believe when our CEO and medical directors took their vaccines on the first day, it also encouraged other staff to come for their vaccine without hesitancy. So I would like to turn towards Ruth. Ruth, you are at the health facilities level, and you are directly administering the vaccines to those that came for it. What can you tell us about your experience that will help your colleagues from Cameroon?
Hi, everyone. Thank you very much, Dr. Charlotte, for the opportunity. My name is Ruth Alote. I work at Kolebu Teaching Hospital. It's a tertiary referral institute under the Ministry of Health. In my hospital, as our senior Dr. Achianu had said, we took part in the national training. We also took part in the in-house training. We had departmental teams because we have over 20 departments in the hospital. So we grouped them so that it will be easy for people to get their vaccines with ease. So we had different vaccination sites, and we made hard copies and soft copies of these sites so that everyone will have access to it. We did a lot of sensitization exercise. We had online sessions where people had to join via Zoom. We went department to department. We even had to go person to person because we had certain people who did not have access to internet and all that. So we made sure we covered everybody. Now, one key thing that we did during the sensitization was to handle issues of vaccine hesitancy. We, by the help of Geneva Learning Foundation, we had people in our hospital who were part of the COVID-19 peer hub, and since July, and so they were well equipped to handle such issues. We also had a slide which covered expected side effects. You know what the fear was, people were afraid because it's a new vaccine. So we had enough time to handle expected side effects. And it's important to note that after the session, most of the people came only with very mild side effects. Only one person, who was a sickle cell patient, had to be admitted overnight. So sensitization is very, very important. People knew why they must even keep on putting on their mask even after taking the vaccine. Now, because it was a new vaccine, we cautioned the departmental staff, if you are in a department and you play similar roles, it was very, very important for you to divide yourself into two so that if half of you can take the vaccines from day 1 to day 3, and then the other half can take from day 3 till we ended. So this thing that we did also helped because people were afraid when they come down with the adverse side effects, who is going to work? So the department closed down. And this thing was very, very important. It helped. The people who had a little headache and fever could not turn up a day, and the other staff were there to help. We also gave caution on handling adverse effects. People had to take paracetamol, but we cautioned people with G6PD. not to hesitate to call in. We had dedicated phone lines, especially for vaccination exercise. And this was made possible through the help of the Geneva Learning Foundation, a course that we took helped us to have a health promotion helpline. And we dedicated most of these lines to help people, engage them for this vaccination, and it really helped. Most people called and there were people just waiting to attend to their calls. So basically, we also had our directors in the hospital taking their turns for the first day, and this actually helped us a lot. People who were hesitant and thinking it was a scam, all the things, the social media things, they realized it was not true. So the next day, our directors were in office. People thought they wouldn't be there, and they saw them with their cards, people holding their cards with the COVID-19 vaccination card in pictures. And seeing the director of medical affairs actually boosted people's morale. So in a nutshell, that's what I can say. Thank you very much.
Thank you so much, Ruth, for that sharing that wonderful experience and giving concrete, really concrete examples of what you did in your own health facility. So right now, I know we are really, really over time. So, but do remember, we went ahead and scheduled this meeting for 2 sessions. So I think there is still so much more that we can get to share, the 2 countries can get to share. So really do hope that next week we could still gather together to continue the discussions. But I think I have a final couple of questions for Ghana, and I'm going to turn towards the Ghanaian panelists that are here, just ask them in a few words to say, that is, what are the main lessons learned that you want your Cameroon colleagues to know? And then what do you wish you had known on the 24th of February when you received the first doses from COVAX, the first doses of the vaccine from COVAX? And I'm going to we're going to listen to Comfort Dede, we're going to listen to Dr. Hilarious, we are going to listen to Dr. Kwame, and then I'll turn over to the Cameroonian team leader. So we are going to start with Comfort. Over to you, please. Can you just introduce yourself and then go ahead with the questions?
Yeah, hello. Good evening, everyone. Very privileged to be part of this meeting. My name is Comfort Dede Tete. I'm the EPI coordinator for the Ghana West municipality. That is one of the districts or municipalities in the Greater Accra region of Ghana. So for us, a lot has been said, and I congratulate the presenters. Lessons that we learned in terms of advocacy, social mobilization, in addressing hesitancy issues, we learned that it will be very good to do a segmented community education and mobilization, especially when you are targeting the entire population. For us, we did it for the health workers, which really worked, as Ruth had shared with you, using different platforms, the WhatsApp groups, going into the department. It really worked for us. So segmented social mobilization and education and targeted key messages. So for us, we also adopted the health belief model, looking at the 5 different constructs, that is perceived susceptibility, perceived severity, perceived benefits, perceived barriers, and then perceived self-efficacy. And we coined messages around this construct, which really did a lot of magic for us in addressing hesitancy in our municipality. We also learned that, in fact, our teams that were given for the campaign were few. We were given only 4 teams. Meanwhile, we had 22 health facilities. So apart from the municipal hospital, the other team was actually mobile, going around the facilities on daily basis, which really didn't help us in a way. So we have also learned that, in fact, it would be good for us to have more teams and have static teams in all health facilities so that we can cover all our people with a bit of ease. And also for data management, because we went electronic, we also realized that the tablets were not enough. So lessons learned to get enough of these devices that will help us in the collation and the management of our data. So far, this is what I have to share with my colleagues from Cameroon. Thank you.
Thank you very much, Comfort. Now I'm going to turn to Dr. Hilarious Abiu. And Dr. Hilarious, what is the most important lesson learned that you want to share with our Cameroonian colleagues?
Right. So because colleagues have already shared most of the things that have been said, I would want to focus on the engagement with the media. The media can be a two-edged sword. I recall that in the run-up to the introduction of the vaccine in our region, we had a number of media engagements. The media are keenly interested, wanting to know how we're going about things, wanting to know what message we had for the populace. And they help significantly in increasing the awareness levels and also dispelling some of the misinformation that was already in the public domain. At the same time, we had to be cautious in how we communicate to the media. I recall that towards the end of our last round of vaccination, a journalist appeared and said he wanted to know that the vaccines were expiring or that we were using expired vaccines, which I explained that wasn't the case. But then again, they shared that information with a third party who went, writing an article that we had so many vaccines that were expiring in our region, which created a lot of misinformation and discomfort in the region. So the media can be a very good ally in terms of information sharing and dispelling rumors, but it's also important that we are cautious in how we manage the information they seek from us. When in doubt, it may be useful to defer responses to higher levels to manage. Thank you.
Thank you very much, Dr. Hilarious. And now we are going to end with Dr. Kwame. And really, Dr. Kwame, thank you so much for being here this evening. So what do you know now that you wish you would have known when you received the COVID-19 vaccines on the 24th of February, 2021?
Yeah, thank you very much. Before I answer that, I think I want to reiterate a few things. My colleagues have said a lot, but I want to also encourage Cameroon to focus on the training of health workers. We did both online and in person, particularly for those that are actually going to handle the peripheral level. It's so important that you need to monitor. It's not just, you don't leave it as just the online training. In fact, you need to be there. I mean, there should be a combination of online and face-to-face, especially for those who are going to do the actual jabbing. It's so important. And this is where I want to link it with what Dr. Akon was saying. I think, yes, there's more room for improvement, but I want to assure him that we trained every person who was going to administer the vaccine. And that even if you ask the EPI manager when people should take their mask off, he will not be able to tell you. So for me, it is not a big issue. If there were issues of quality, then I'll be worried. But for them not to be able to tell when masks will be taken off, I don't think he should work himself up too much about this, because it is a national decision, it's a national policy, it's not for an individual vaccinator to do that. That is quite what I want to reassure him about. About the engagement, it is so crucial. Engagement should be at all levels. Dr. Hilarious Abiu has already talked about the media, being cautious with the media. Of course, he's also mentioned the double-edged sword. You see, the problem with the media is that if you don't talk, they will fill the void. If you talk, they misinterpret. So you need to be, balance it. If you leave the media out, they would always fill the void. You need to talk to them, but of course, you need to know which level and what message to give. Then partnerships, very, 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 very important. Crucial. Let the people who are in charge of certain activities, they take their job. For example, adverse event. Hitherto were the ones doing everything. Of course, we still had support from FDA. But for these new vaccines, we relegated everything to the Food and Drugs Authority. Take charge of the regulatory side so that we will concentrate on the other technical aspects. And it's really, really helped. So any rumors that comes about vaccine, as it were, in terms of adverse events and all that, it's the FDA that answers it and not the health sector. Of course, we support as well. But it's so crucial that you let the regulatory authority do their job and then you support them to do it, because it's a win-win for the two. Data management, yes, one of our colleagues mentioned about the devices. Yes, we had initial issues with the fact that we did not have enough of the devices. And this is what we would have wished to know. So I'm answering your last question in disguise. Data management is key. And we wish that we would have known that we were going to get a lot of people aggregating at the vaccination centers before we even started. We would probably have postponed our delivery a day or two to make a case for the devices. But for now, we are getting the electronic devices from quite a number of partners, including the World Bank and, of course, the government itself. So we are happy that the next delivery will be better. So in this, I think that's all I want to leave with our Cameroonian team. Over.
Thank you. Thank you so much, Dr. Kwame. And right now, I was just about to turn towards Martha Ngoe, team leader for Cameroon. Unfortunately, okay, she's back in the room. So Martha, I hope you're getting me now. I want to ask you, Martha, you after having listened to all that which has been shared here tonight, what do you expect to be your greatest challenge as far as the COVID-19 vaccine introduction is concerned in Cameroon, which has already started? And how does the experience of Ghana tonight help you? Martha? And if Martha is not able to answer us, I may. Okay, Martha, over to you. Your mic is now unmuted.
Thank you, Charlotte. Thank you to all those who have shared it. Hello?
Yes, Martha. Yes, Martha, unfortunately, we can't hear you.
Hello?
Yes, we can get you now.
Hello?
So I would like to, if we can't get Martha, I would like to turn to another person that's directly involved with the COVID-19 vaccine introduction from Cameroon. And I do hope that, so I want to invite Dr. Ngoe. Please, can you just, you are also involved in the COVID-19 vaccine introduction. Will you be able to tell us something as far as these questions are concerned, the major challenge? And after listening to Ghana, the experience of Ghana tonight, will that help to overcome that challenge? Dr. Mboke? Like they're having real issues of internet connectivity tonight.
Hello?
Okay, Dr. Mboke, over to you. Yes.
Yes. Thank you, Charlotte, for giving us the opportunity to say something about the introduction of COVID-19 vaccine in Cameroon. Really, we are really glad to hear this really interesting experience from Ghana, because the introduction of COVID-19 vaccine in Cameroon have been done in emergency. So the planning activities that were all the activities that were planned so that the vaccine could be introduced did not follow all the steps in the introduction of the new vaccine, what we are supposed to follow to come and be able to introduce the vaccine very well. But what we have learned really from Ghana is the real leadership of the country's head, as what they have used to be able to capture all the different population level. As the president was vaccinated himself, the president and his family was among the first one to be vaccinated. those are the specific things that we think if we also can use them, they can really help to convince the population, because the real problem we have here is the vaccine hesitancy, the communication. Yes, we are really happy to see that things that we thought about it in our communication plan. Yes, if we really use them as we have had the experience from Ghana, everything can work well for us in Cameroon too. Yeah, apart from that, we have what Ghana is using, especially in the monitoring of AEFI. As I asked the question, all the tools, they are not using only one system, they are using the paper-based, they are using ODK, they are using different platforms to be able to record and to follow up all they have on field concerning the vaccination. So I think it was really an enriching experience that we think if we are really happy and lucky to have Ghana that have gone so far. So I think the country can really dwell on what we had tonight to be able to get on all our target population. So I think for now that's what I can say. Yeah, thank you.
Thank you very much. Thank you very much, Dr. Mboke. Eric, from in charge of monitoring and evaluation at the National EPI program in Cameroon. So there are no more raised, but there are lots of interesting comments in the chat, and also question. If your question has not been answered today, we are going to take a record of all of those questions and we are going to share with the Ghanaian team. I would like to really thank all of you that joined this session today, but I don't think I'm actually the best person to do that. So I'd like to turn towards Daniel Adu Asomaning, the convener of this inter-country rapid learning session, for closing words and remarks.
Thank you very much, Charlotte. And I want to thank each and every one of us here for our time, our attention, and immense knowledge shared. And I'm very much convinced that you all know in ourselves that there are some things we can do to help in the fight against COVID-19. And this is a call for all of us to contribute our quota. And we sought for ourselves as a scholar group to be a level of support for the national EPI program. And indeed, we can see from what has been happening that we are doing our possible best so that we can lend a helping hand to the national program. And with the support of Dr. Chiano, we've organized several meetings, several training sessions for other health workers within the district level to help bridge the knowledge gap, and several other activities. I think in moving on, we would want to continue to engage all stakeholders, just as we all said, especially from the side of our colleagues from Cameroon. If we wish to do everything all by ourselves, we are going to struggle. And the main purpose or the main reason for the success Ghana has made is bringing on board all other stakeholders who have a stake in ensuring that we have a very healthy population. The lesson I have learned personally in the introduction of this vaccine was underestimating the hesitancy among health workers. I was thinking as health workers, we were just going to accept it, until I realized that health workers were community members before becoming health workers, and we are still community members. So hesitancy shouldn't be an issue that we look elsewhere beyond health workers. We are not far from we ourselves being corporates. So I would advise our colleagues from Cameroon to look at it very well and ensure that we have all that on course. And just as we said, we hope that next week we will have another session where we will be taking presentations from the sub-national level, that's the regional, that's the provincial level, and the district levels, and even at the facility level, so we can know at the micro level what happened and how the implementation was done at that level. I would urge all of us to make it a point to attend. It's going to be much more interesting, and I hope that all questions that didn't get this due answers or that were answered, we'd have ample time to do that. So on this note, I want to thank everybody for coming, especially our facilitators, for the immense knowledge you shared with us. Thank you. Over to you, Charlotte.
Thank you very much, Daniel. And as you have all heard, he has renewed the invitation for next week. So we do hope you'll be able to join for a more discussions, and that will be more intimate this time, only in the Zoom room. But we are going to come back to us as social media platform with feedback for you on how it goes. So until then, I think I'll turn towards Reda to recognize all those who have been following us for almost 1 hour 30 minutes on our various social media platforms.
It's really remarkable, Charlotte. Congratulations to the both Ghana and Cameroon teams for organizing this. You are building your own capacity, and I think that self-determination is key to actually achieving the kinds of results you are aiming for. What's remarkable too is that on the social media platforms, we actually have more people watching at the end than we did at the beginning, significantly more. So this event has managed to retain the attention of busy immunization professionals on what is for most of you Sunday evening. And for those of you who are connecting, we have a large number of participants who connected all the way from Pakistan, for whom it is very late into the night. So again, look forward. I can't wait for next week's session, and the teams do have the option and may opt to keep some of the discussions private, in which case we will be giving a summary with the team leaders if they are available. Once again, thank you. Just want to share greetings from all over the world that are coming in. From Emmanuel says, wonderful interactive presentation, nice presentation from the Ghana country team. Amel El Taher says, thank you, great work. Jeanne Mao says, merci à tous. So you have some French thank yous as well. Many other greetings and questions. Take care.